We talk about the concept of Sitz Bath. Sitz Bath is something that I first of all heard about Sitz Bath when I was reading about hemorrhoids. And I heard that yes, there could be a bath where basically they could put water in a bowl like this, or they could put a shallow, can you see the shallow basin? They put it in the toilet, all right? Then they actually what? Fill it with warm water, all right? Then you could just use the warm water like that, or they could add some things, some additives into the seed bath, and basically what you use it in treating hemorrhoids. Okay, but I got to see that seed bath has a lot of other application, like for women who are menstruating, for women who just gave birth, for people who just underwent a surgery in the perineal area, or people who have general injury in the perineal area. Okay, you can actually what do a seed bath, right? So I was like, wow, this concept is worth researching on. All right, so we get to look at the concept of seed bath and see its application in medicine. So you guys have seen all these pictures. Seed bath is a warm water bath, and this is used to what soothe and cleanse the perineal area, especially after childbirth, surgery, or injury. Okay, so I'm adding that it can be used to treat things like what anal fissures, hemorrhoids, or generally any problem in the perineal area. Okay, all right. So what are the benefits? It will help to relieve the pain and discomfort. It will reduce swelling and inflammation. It will promote what? Healing and recovery. It will cleanse the perineal area. It will relax and calm the effect. All right. So what are the types? We have the warm water seed bath. Okay. We also have the cold water seed bath, right? But the warm water seed bath is kind of like the most common though, right? But anything you are trying to treat has the type of seed bath you use, right? Here is just a brief overview for students, for them just to know that okay, this kind of thing like this actually exists. Okay, we also have cold water seed bath. Then we have contrast seed bath, where you are alternating the patient between the warm and cold water types. Indications: times when you should use a seed bath, which is very important. Okay, so postpartum care, that's after giving birth. If the person has a perineal trauma or injury, if there's hemorrhoids, all right, it was I was actually reading about hemorrhoids. That's when I came across the concept of seed baths. All right, it could be anal fissures, it could be proctitis. Proctitis, what is proctitis? That's inflammation of the what rectum. All right, it could be even be sigmoiditis, but sigmoiditis is kind of like far inside. So let's leave it at proctitis. Right, it could be post surgical recovery, like a surgery like what hysterectomy. All right, then episiotomy. All right, so for fast recovery from any of these surgeries, you can actually what do a seed bath. All right, contraindication: if somebody has, like, when you shouldn't use a seed bath, somebody has an active vaginal bleeding, you don't want to use that. If somebody has open wounds or infections, you should use with care. All right. If people are allergic to what bath additives, because I told you guys that there are some things that will be added in the water. There are some things that will be added in the water. All right. So if somebody is allergic to it, you don't want to use that again on the person. All right. So it could be used to treat what? Here you see menstrual cramps, right? I was telling you guys about menstrual cramps, piles, that's hemorrhoids. I'm used to treat fissures, can be used to treat what? Fistula. Right? So how do we prepare the seed bath? You fill a Sitz bathtub or a large bowl with warm water. That's why you see they will always talk about warm water, but there is a cold one, but the warm one is the most popular one, right? Then you add the bath salt or baking soda. Just simply say what you add: seed additives, right? So the person will sit in the bath for about 15 to 20 minutes. They will now they will now just dry their self with a towel, okay? So they can actually be repeating this, alternating, be repeating this till their condition is basically what um done, all right? So that's it on the concept of seed baths.